study coming out that more black Africans die due to COVID-19 compared to their white counterparts in South Africa. And I can hear you saying it's about population. No, it's not. It's not because blacks make up the majority of the population in our country. A study by the National Institute of Communicable Diseases has found that black people are less likely to actually have access to intensive care units and ventilators. In addition, they're likely to be hospitalised at a younger age. Let's unpack this study with Dr. Wasila Jasat, the lead on the study at the NICD, the National COVID-19 Hospital Surveillance System, joining us. Doctor, good morning. I really appreciate your time in joining us, Dr. Jasat. I wanted to say you're the lead on DATCOV, but I don't quite know if I'm saying the acronym correctly, DATCOV. Regardless, tell me about the study and how we got to this outcome. Good morning.
Good morning, and thanks for having me to talk about this very important topic. At the NICD, we set up a hospital surveillance system in March 2020 at the start of the pandemic because we needed to know, what COVID was going to be like amongst those who were most severely affected. And we got all public and private hospitals to report COVID admissions to a surveillance system. So we've got over 500,000 admissions and over 100,000 hospital deaths that have been reported thus far. And we've done much analysis from this data. But one set of analysis that was important to me was to look at, in the context of South Africa's inequality, what the impact of COVID has been across the different race groups and across different social classes. And so we analyzed data on COVID admissions and deaths, looking at, whether there were any differences in impact on COVID mortality, depending on what race you were and what class you were.
So the resource gap seems to be the biggest issue here, and it's not new. It's not something that came out just because of COVID. The resource gap between public and private healthcare, I can only imagine this has played a significant role in this as well, didn't it?
Yeah, so those who were admitted in public hospitals had a much higher risk of mortality than those admitted in private hospitals. And we know that there's much more money spent in the private sector than in the public sector in South Africa. And more money buys you more doctors, more specialists, better equipment, better medicines and, hospital services and, more capacity. And so we know that, in the private sector, you had less of a barrier to getting a bed than you did in the public sector. Also, people who seek care in the public sector, many of them in rural areas, travel long distances to a hospital, and most often it's a district hospital that doesn't have an ICU or a ventilator or staff that are skilled and trained in intensive care. And so many black rural people who got COVID faced barriers to getting to the hospital, got to the hospital already quite sick, and once they were in hospital, were less likely to be able to get access to life-saving measures like ICU, treatment and ventilation.
It's broad inequalities, isn't it? If ever inequality in our country was brought to the fore, it was because of COVID-19. We go back to the early days, of course, the first wave. Many black people in the country working in essential services, living in crowded areas, having to use public transport. This is not new data, but it did have an effect on the study, didn't it?
Yeah, I think that, COVID revealed the long-standing inequalities in the country, but this is not new, unusual for South Africa. Other studies in the UK, the US, Brazil, and many countries have also revealed that Black, African, and minority ethnic groups had a higher likelihood of being infected and dying than white people. So this does seem to be something that's been reported consistently globally, but in South Africa, as expected because of our history and, sort of the inequalities that black people have faced, we saw that particularly with COVID, and we saw a much higher mortality if you were black, colored, or Indian than if you were white from COVID-19.
And Doctor, just as I say goodbye to you, a last question briefly, if it's at all possible. It's not just black Africans who were worse off in this case. Let's just talk about the Indian and mixed race population as well. The numbers didn't look good for those race groups either, did they?
Yeah, so, in our analysis compared to whites, blacks, Indians, and coloreds had a higher risk of mortality. We don't really understand these things well. We know males have a higher risk of dying. We know older people have a higher risk of dying, but we don't quite understand what's at play in terms of the racial differences. Is it biology? Is it genetics? Or is it just, the structural inequalities? Because we know that if you are Black, you're more likely to work in essential services, travel on public transport, live in multi-generational houses where you can't, overcrowded situations where you can't isolate. You're less likely to get access to healthcare and less likely to get access to high-quality healthcare. And so I think all of those things probably have a role to play in explaining why we saw what we did in this study.
Well, I'm going to say thank you very much. Fascinating study as well. I'm so glad to have had you on the show to unpack it for us. So Dr. Wasila Jasat, lead on DATCOV, hope I got that right, at the NICD. It's the National COVID-19 Hospital Surveillance System. Very interesting numbers coming out of COVID and our racial breakdown in the country.